All right, so today we're diving into a topic that's moving from the absolute fringes right into the heart of modern medicine, psychedelics. And look, we're not talking about their counterculture past. We're looking at their incredible reemergence as a powerful clinical tool, especially for people who feel like they've run out of all other options.
I want you to just imagine this for a second. You're facing a terminal illness, or maybe a severe case of PTSD, or depression so deep that nothing seems to work. You're up against this profound psychological pain, this existential dread that all the usual treatments just can't seem to touch. What do you do then? Where do you go? Well, that single question is exactly what's reigniting a whole field of science that was, for a long time, totally dormant.
You see, for so many people, this isn't just a thought experiment. It's their reality. They hit a wall. Conventional therapies, they do a lot of good, for sure, but sometimes they just fall short when they're up against the deepest kinds of human suffering. We're talking about that paralyzing anxiety that comes with knowing your life is ending, or the kind of psychological wounds that just refuse to heal. And this is where our story really kicks off.
And this quote, man, it just puts a human face on the whole problem. This comes from Joanna, a 40-year-old mother of four who was diagnosed with cancer. And her words, they just cut right to the core of it, don't they? It wasn't just about the physical pain of the present, it was that crippling, constant fear of what was still to come.
So how do you treat that kind of fear? A fear of the future itself? Well, the answer might actually lie in a tool that isn't new at all. It's more like a tool that science is rediscovering. Decades ago, psychedelic-assisted therapy was this incredibly promising field, but then it was basically shut down. And now, all that research is being brought back to life.
So if you go back to the 1950s, researchers were seeing just incredible potential in substances like LSD and psilocybin. They thought these could be revolutionary for mental health. But then, in 1971, the Convention on Psychotropic Substances brought nearly all of that scientific research to a grinding halt. For almost 30 years, the entire field was just frozen in time. And it's really only been since the 2000s that we've seen this renaissance, a new wave of rigorous, controlled studies bringing these tools back into the lab.
Okay, so what actually happens inside one of these sessions? It's really not as simple as just taking a substance and seeing what happens. The therapy involves a ton of careful preparation and expert guidance. The whole thing is framed as a journey inward, like a guided exploration into the deepest, most hidden parts of your own mind. And yeah, starting this journey, it can be absolutely terrifying. These are the words of Gloria, another patient with cancer. You can just feel her apprehension, right? I mean, think about it. You're about to willingly confront the very things you've probably spent your whole life running from, your deepest fears, your own mortality. It's really no wonder she says she would have gladly refused.
Now, at the very heart of all this research, there's this one central idea, the death-rebirth experience. Let's be clear, this isn't literal. It's a deeply powerful psychological event. Patients often describe it as a kind of symbolic death, a complete dissolving of their ego, a direct, unfiltered confrontation with the idea of mortality. And what often comes after that is described as a kind of spiritual rebirth, a fundamental renewal of their entire perspective on life.
But getting to that breakthrough it's almost never easy. In fact, patients often describe it as a titanic struggle. There was one patient, Ted, who relived his traumatic memories from the war and felt all the pain of every person he'd ever hurt. Others describe seeing these scenes of cosmic destruction, feeling like they're on a razor's edge between total agony and pure ecstasy. It is an intense and often grueling process.
But through that intense struggle, that's where the breakthrough happens. This is Gloria again after her session. Coming out of that chaotic, overwhelming inner world, she found this simple, profound clarity. After confronting what felt like a void, the one thing that was left, the one thing that made any sense at all, was love. And that right there, that's the moment of transformation that has researchers so completely fascinated. So, after this intense inner journey, what happens next? What happens when these patients come back to their everyday lives? Well, the research describes something much more than just a temporary mood boost. It's a lasting, fundamental shift in how they experience the world, their illness, everything.
I mean, the scale of the change here can be just remarkable. Take Ted, the patient we mentioned earlier. Before session, he was totally bedridden, on narcotics just for the pain. Afterwards, his pain was so much less that he stopped the drugs completely and was actually able to do social work for months. Another patient, John, saw his depression and his untreatable pain just vanish, which allowed him to reconnect with his family in his final days. The fear of death often dissolves, and in its place comes this sense of acceptance and the totally renewed appreciation for life.
You know, these individual stories, they're incredibly powerful. But what do they mean for the future of mental health care as a whole? Well, if you look at the current scientific landscape, it's pretty clear this is not just a handful of interesting case studies anymore. It's becoming a movement.
450. Just think about that number for a second. According to a UN report as of February 2023, that's how many registered clinical studies were out there investigating the therapeutic effects of psychedelics. This isn't some fringe interest anymore. This is a massive, coordinated, international scientific effort. And these studies, they're not just for anything. They are tackling some of the absolute toughest challenges in mental health care. The focus is overwhelmingly on the conditions where our current treatments often don't work well enough. Severe PTSD, depression that won't respond to any medication, debilitating anxiety, and of course, the kind of end-of-life distress that patients like Joanna and Gloria were facing. The real goal here is to see if these profound experiences can be reliably and safely harnessed for healing.
And all of this, really, it brings us to a final, pretty profound question. For centuries, medicine has looked for solutions on the outside, pills, procedures, external interventions. But this research, it suggests something totally different. It really makes you wonder, what if the most powerful healing potential we have doesn't come from a bottle, but from a guided journey into the deepest, most mysterious territory there is, our own minds?